My name is Brian Gunnell. I work with the University of Virginia Health, serving the rural populations of Virginia through telemedicine. We have about 108 clinical sites that we connect to around the state of Virginia, pushing around 1,100 Jabber users at this point in time. So our top three priorities for collaboration are basically to expand the reach of doctors to patients, giving them better access to the patients in their homes before they come in for treatment, as well as to reach further out to patients in the field and giving them more access to care back to us. So whether that's for them to be able to reach out to a physician from their home or to go to a facility in their local community and connect back to the medical center. So it was very difficult for us to be able to tell what was happening on these live calls. And when you're talking about a telestroke encounter, so a physician seeing a patient trying to determine if they've had a stroke, call quality is very important. You're looking at the efficacy of eye movement, hand movement, and those types of things. And so having a very high quality call is of the utmost importance. What Vyopta was able to allow us to do is to see into those calls and to find out what's happening before the neurologist would call us a couple days later and say, hey, that call was bad. So by getting that live information back, so it really helps us dial in to figure out what's going on with the calls and to serve the physicians better. We've been using Vyopta for a long time, and we use it mostly now for just live information coming back from our system, so that live quality data. We operate a 24/7 stroke program with 7 hospitals. Some of these have limited bandwidth into the facilities, and so it really helps us to sort of monitor those programs. And one of my jobs is, as an engineer at the University of Virginia, is pushing these endpoints further out into the field, using Vyopta to be able to monitor a call coming in from an ambulance that's moving in from the hospital, can lay that down against the geographic map to help us determine where we can make connectivity has been a very powerful thing for us. So using that detailed call information that Vyopta provides for us, along with a GIS map, we can pinpoint locations within our community that we can make connections so we can see patients before they're getting to the hospital. And that's been a truly powerful thing for us to leverage to reach out further into the field. The other thing that I think Vyopta has really came back to for us is we weren't using Vyopta for overall tracking of system usage in the beginning. We've primarily been a clinical operation of the hospital, but we're sort of shifting into this collaborative role now. But what Vyopta does is give us a glimpse into what it looks like across all those different platforms. So if I can see what Zoom is and how it's integrating into my solution, I can get the usage information sitting right beside my WebEx deployment, and that's very powerful for me in one tool to be able to go see how much each system is getting used, the quality coming off of each one of those systems. So we find that to be very powerful information.